Now, for many women, the word menopause is synonymous with painful sexual intercourse, dryness, and other vaginal symptoms. Well, it's also the case for many cancer survivors who have undergone hysterectomies and other treatments following breast cancer. But it doesn't have to be that way, thanks to a new FDA-cleared procedure called the MonaLisa Touch that revitalizes vaginal tissue and helps cells produce more collagen. So how is it changing women's lives? Well, joining me now to discuss is Dr. Mickey Karram, an internationally renowned urogynecologist and a pelvic surgeon, and Lisa Elliott, a patient of Dr. Karram, who was diagnosed with breast cancer. So thank you both for joining me today. And Dr. Karram, I'll start with you. So just exactly what is the MonaLisa Touch and how does it work?
So this is a type of laser therapy that's administered to the skin of the vagina, and it basically does some things that restore vaginal health. The vaginal mucosa, or the skin of the vagina, is very dependent on estrogen. When a woman passes through menopause and loses that circulating estrogen, basically the tissues become very dry and very sensitive. And it's very, very common to start to have complaints of pain with intercourse and burning and irritation and a variety of other symptoms. This is a unique laser therapy that can be done in a very minimally invasive fashion with very little pain that basically restores those tissues to a state that they were in when there was normal circulating estrogen.
So we can see here, there's an image, I don't know if we can just see that again, guys, that'd be great, just to show what is actually going on here then, what's happening.
So this is the probe that delivers the laser energy. It's light therapy, that's all a laser is, and basically the probe is introduced into the vaginal canal until it gets to the top of the vagina, and we release the laser energy at 1 centimeter intervals and withdraw the probe all the way out to the opening of the vagina. It truly is a procedure that doesn't require any anesthesia, can be done in a matter of minutes, and is very safe.
Is it painful?
There's literally, and I don't say this
actually,
lightly.
Well, I should ask Lisa, actually.
She'll confirm what I'm going to say, but there's very little pain. The only sort of pain that we've had to deal with is that initial passage of the probe up into the top of the vagina, because the vagina is very sensitive. The actual laser delivery is felt by most patients to be a vibration. We've not had anybody that's not been able to tolerate the procedure. We've treated in the range of 70 patients now.
And have they all been patients who have gone through menopause, or are there other conditions that this is actually effective for?
So a variety of different conditions. The most obvious is the natural menopause, which is around 50 or 51. Patients like Lisa, who unfortunately have had breast cancer, many times are put on drugs that suppress estrogen and can't take estrogen, and so that's a big subset of patients. We have 250,000 patients every year diagnosed with breast cancer in this country.
Wow.
And then patients that have had surgery that required removal of their ovaries. Those are the big three categories.
So, I mean, Lisa, tell me, how did you find out about this, and why did you think that this was the right treatment option for you?
Well, I have to admit that I'm actually a pretty stubborn person. After I started experiencing these symptoms, and that was probably 2 years or so after I had finished my breast cancer treatment, I was calling my gynecologist. Now, I'm very lucky in that my gynecologist happens to be my best friend, and so I would call her all hours and I would say, you have to do something to fix this. You have to figure out a way that I can get some relief.
What were some of the bigger problems for you?
I couldn't have sex at all. And, as a 30-year-old woman, that's detrimental. I mean, I'm in a relationship, and that's causing emotional problems as well as the physical problems.
Sure.
And so I told my gynecologist, and like I said, my best friend, I said, you have to find something to fix this. She just kept saying there aren't any treatments available. Everything is estrogen-based. Everything is systemic. We can't risk giving that to you because, of course, your breast cancer could come back, which I knew. So I was very lucky. It was very serendipitous that Dr. Karram happened to be presenting this laser to her gynecology group. They work at the same hospital. And so as soon as he presented it, she said, aha, this is something. And I was just very lucky to be able to get into the clinical trial.
And you know, obviously you mentioned your breast cancer, I mean, affected you in your 20s. Was this a side effect that you even had a kind of remote idea was around?
None at all. In fact, you know, I was shocked in a way because this isn't something that even postmenopausal women talk about. So it certainly isn't something that breast cancer survivors talk about. I have now, of course, that I've gone through the process, talked to so many women who have gone through menopause naturally, and they'll say, well, I thought that this is just something that I had to live with. This is part of the change. I don't accept it. I feel like there has to be something to fix this. And so, you know, like I said, was just very stubborn about it. But you're right, it's not a topic that is discussed among women. Whether it's an older generation or a younger generation, vaginal dryness and painful sex is just something that women, I think, feel like they have to live with, but thankfully you don't anymore.
Well, I mean, that's interesting because it's like, how does this sort of really fit into the wider conversation, which is the way that society treats women and sex in general, right? I mean, you know, the fact that you're here talking about having experienced non-existence or painful sex is huge because women aren't supposed to talk about that kind of thing, right?
Right. And I think that there is, of course we live in a society where, sex is pretty open, but there are certain parts of it that aren't. And there are women out there suffering in silence because they think that maybe it's not appropriate to talk about it, or there's something wrong with them. It's not something that all women experience. Maybe, they might think that, oh, this must just be me. It's not. It's everybody.
Yeah, I mean, Dr. Karram, when you've had patients come to you, have they said that to you? Have they said, I think it's just me, I'm sure there's nothing that can be done?
Yeah, I think that most women have this perception, unfortunately, that this is a natural part of aging. And this is just something you deal with. And they suffer in silence, unfortunately. And we see that in a lot of different aspects of female pelvic problems. We see it with bladder control. We see it with bowel control and things like that. So yeah, there's a tremendous amount of misperception that this is something that just naturally occurs, and there's not anything you can do about it.
Yeah, I mean, Lisa, for women out there that are suffering in silence, as Dr. Karram said, what would you want to tell them?
There are treatments. You have to be persistent. You have to go to your doctor and not accept, I'm sorry, I can't do anything about that, as an answer. And keep doing your research and look at the MonaLisa Touch. It's a great option, especially for women who can't have any other kind of like estrogen or any other systemic treatments. And for me, at least, that was, my biggest fear, is you don't want to do anything that might cause cancer to come back. And in fact, you feel grateful, oh, I'm alive, I should be happy with that. Maybe I shouldn't complain about this other stuff. But you don't have to live like that. So stay at it.
I think that's a fantastic note. And Dr. Karram, finally, I mean, would you say that this is a real game changer?
I really think it is. It's unique in the sense that it addresses the problem in a mechanism that we've never addressed it before. As Lisa alluded to, the fact that up until now it's basically been local estrogen therapy and some other hormones, lubricants, a variety of botanicals and things like that. They're difficult to administer, they're messy sometimes, and the efficacy is questionable. And then there's side effects and issues with it. This is very unique in the sense that it's a procedure that can be done. It addresses the problem almost immediately. We see results within a few days in a lot of patients. There's good data and good studies from Italy. Somewhere in the range of 15 to 20,000 women now have been treated worldwide. We were fortunate enough to do the first study in the United States in Cincinnati in conjunction with a colleague of mine at Stanford. And our results are duplicating what they've shown in Italy. So it's exciting. This obviously will continue to follow patients, but the results have been extremely positive.